Hey, this is Savannah. This is my ACT video submission for Skills Validation, Pharmacy, and Hydrotherapy. When talking about controlled substances, these drugs are under more legal control so they don't end up in the wrong hands or they're not abused by people that aren't really needing them. Controlled substances are usually managed by the DEA, or also known as Drug Enforcement Administration. The doctor must maintain accurate records of all controlled substances so they keep a true and active log to know where these drugs are going and where they're being purchased or dispensed. It usually creates a system for the DEA to track each bottle of controlled substance, so if they have a wrong batch or if a manufacturer messed up in some way or something happened, they could track it back from the source. Records are regularly inspected by the DEA, and commonly used controlled substances would be factored by schedules. So Schedule 1 would be heroin, Schedule 2 would be morphine, Schedule 4 would be Valium, Pentobarbital, and then Schedule 5 would be cough syrups. A few other commonly used drugs would include topicals such as flea and tick medications, orals like gabapentin, propane, and then moving on to hydrotherapy. Hydrotherapy is the external use of water in treatment of disease or injury. The most likely reason for hydrotherapy is for spraying water onto a wound to wash away debris and keep the wound clean. So if there's like a dog bite or a puncture wound, you want to flush that out to make sure it's clean and that the medication that would need to be applied goes straight onto the source. When performing a type of hydrotherapy, care must be taken always to ensure the water temperature is tepid or lukewarm. You want to make sure that the water isn't burning and it's not cold, because then it could be ineffective. The flow should be forceful enough to make sure that the debris and the bacteria or anything that's in the way of the wound is not blocking it anymore. But it doesn't need to be a painful extent to where you are making the wound worse. The use of underwater treadmills has become more popular for the method of hydrotherapy because it's prescribed as a rehab tool for post-op orthopedic and neurological cases, as well as soft tissue injuries, such as like a sprain or a tear in a muscle. The buoyancy of the water not only decreases the impact of animal weight, but it also helps their joints when building up resistance. You always want to make sure that the water is safe and comfortable for the patient, because you don't want to burn or make any injuries worse or traumatize the patient where they aren't interested in doing it anymore. Thanks.